Buddy. I'm Jim Krieger, the Executive Director of the Northeast Side Senior Coalition. On behalf of my partners back here, the East Madison-Monona Coalition of the Aging, the South Madison Coalition of the Elderly, and the West Madison Seniors Coalition, I want to thank you today for joining us at this event. I also want to thank Terrence Thompson and his staff for the use of Warner Park for today's press conference and for their continued support of the programming that we have here at the Center for Senior Adults. Today, our four coalitions are formally announcing a merger effective January 1st of 2019. In about 20 minutes, we'll do what everyone's been waiting for. We're going to unveil the name and logo for our new organization. Quickly, I just want to take a couple minutes for those unfamiliar with our senior coalitions to give you an overview of the primary services that we provide to the seniors in this community. We provide case management services to help low-income seniors access the needs that they are unable to obtain on their own. Things such as getting food in their homes, transportation to medical appointments, finding affordable housing in the community, renewing benefits like Medicare Part D, and advocating for any other needs that they may have that they are unable to get for themselves. Our case managers also check in on our seniors on a regular basis to see how they're doing and help them out, again, assist them any way they can. We also operate senior meal programs. We provide a nutritious meal Monday through Friday at various meal sites throughout the city of Madison and Monona, including right here at Warner Park. We recruit volunteers to assist seniors with basic home chores that allow the seniors to remain in their homes longer. So if anyone wants to mow lawn or shovel snow, please see us afterwards. And we provide many daily activities for seniors. We offer health, education, recreational, and social activities, such as foot care clinics, speakers on health, wellness, and safety-related topics, technology assistance for seniors, exercise classes, card games, musical performers, bingo, and many other things, as well as volunteer opportunities for seniors who are interested. But we would not be able to do and accomplish all that we do without the financial support of a number of entities. The City of Madison, with its Community Development Division, and Mayor Soglin, the Dane County Department of Human Services and Lynn Green, the Area Agency on Aging of Dane County, County Executive Joe Parisi, the City of Monona and Mayor Mary O'Connor, and the United Way of Dane County and Renee Moe. I also want to acknowledge Melissa Sargent, our state representative, and Paul Rusk, one of our county board supervisors, are here today. Thank you so much for all that you've done to help us do what we do for seniors. The merger process has also presented challenges. We'd like to thank from the city, Jim O'Keefe, Laura Noel, Christine Beatty, from the county, Cheryl Batterman, and Tom Linfield from the Madison Community Foundation. All these individuals were essential for helping us get to this point. And our coalition board of directors also should be thanked, because they put countless hours in and dedicated a lot of their time and energy in working on this merger, and we greatly appreciate their efforts. I found that our next speaker is quite knowledgeable and concerned about the current issues affecting seniors in Dane County. We appreciate his ongoing support of the work done by the senior coalitions. Here to talk to you now about why supporting senior issues is important for the whole community is County Executive Joe Parisi.
Thanks, Jim. Good morning. Thank you all for being here today. This is really a special day. We have a community in which people work together. We don't really have to worry so much about turf wars in Dane County, and that's really nice. We have folks coming together, all for the common good, all for a common cause. And the fact is, what we may think of senior centers and the benefits that seniors derive from them, that's kind of obvious, right? And those benefits are important, but senior centers benefit the entire community. They help people stay productive, they encourage volunteerism. They're actually, when people have more interaction, you have less and more manageable chronic disease. You have people engaged in intergenerational activities that benefit everyone. And our senior centers are really the gateway to to community resources and to making these connections. We refer to our senior centers as senior focal points, and that's because people come to the focal point, and again, it's that gateway to services. It's a gateway to meals, health and fitness programs, transportation, social activities, education, the arts, you name it. And again, that intergenerational connection that happens. Because face it, in our society, as we age, sometimes it seems like society kind of likes to keep on going and look forward and not back, and look at how we got here and look at the years of knowledge and wisdom that exists within our community. And we have to keep those connections, and we have to actively work to keep those interactions. So I'd like to congratulate the coalitions again for this work. As I said, you know, it's easy for people to just get off into their own neighborhood, into their own center, and just focus there. But when we come together and we share resources and we connect, not only is it more efficient, but we learn from each other and we all benefit. So congratulations. I'm looking forward to the unveiling, and thank you all again for being here today. We appreciate it.
My name is Sonia Lindquist, and I'm the Executive Director of the East Madison-Monona Coalition of the Aging, and it's really nice to see all of you here. And I'd like to spend a little bit of time explaining to you some of the three major issues that affect seniors in our community, and these issues were things that prompted the four coalition directors to come together and start talking about the idea of merging. The first of those issues is the dramatically increasing number of seniors. You all know about the baby boom generation, and every day about 10,000 seniors throughout the United States turn 60 or 65. They're aging and becoming seniors. And so not only do we have this large influx of seniors because of the aging of baby boomers, but people are living longer. And so there is a growing number of seniors. In Dane County, the people ages 60 and over are currently the fastest growing demographic, and by 2040, 1/4 of Dane County's population will be over age 60. In Madison and Monona alone, there are currently 37,000 people who are age 60 or over. The second issue that the four senior coalitions in Madison were noticing is that in the past decade, there has been a growing number of issues of concern for seniors, and there's been a growing complexity in those issues. And let me highlight a few of those that have been having an impact. Many baby boomers did not save as much money as maybe their parents or grandparents saved, and so they find themselves that they may be short of money or outliving their retirement savings. Many seniors have no family supports. Their family members no longer live close to them. They may have become alienated from family members, or their spouse or significant other may have died and they're living alone. More and more seniors, we find, are dealing with mental health issues or alcohol and drug addiction issues. These issues have a significant impact. These issues have a significant impact for seniors on all areas of their lives, and they become very difficult to manage because currently in our area there can be a 6-month to 1-year waiting time before somebody can access mental health resources. Other issues like dementia, which is a health issue, or some mental health issues like hoarding, can have an impact on a senior's life and make it difficult for them to live independently or care for themselves. In our community, there's a lack of affordable housing, and there can be wait lists of a year or more in order to get into affordable housing. Because of this lack of affordable housing, there can be a real stress for financial security, and seniors can become homeless. Another issue that's facing seniors is the lack of transportation, and because of that, it's difficult to access food, health care, and socialization opportunities. And so because of inadequate transportation, this can contribute to poor nutrition, poor health, and isolation for seniors. And the third series of issues that we as coalition directors were noticing is that while we have an increasing number of seniors and the issues that they're facing are increasingly more complex, there is a decline or decrease in resources that are available to help seniors access resources that can help them. And so cities, counties, federal programs are all much more limited, and they put people at risk. We find that municipalities are trying to do more with less, but often they are only able to do less even though they would like to do much more. In this context, the four Madison Coalition directors came together with our boards and began the talk of how we could consolidate and ultimately merge so that we could provide better services and more services to seniors in this area. So I'd like to give you some other people to listen to. And first I'm going to introduce Mayor Mary O'Connor. She's the mayor of the city of Monona. And our agency, East Madison and Monona, has served seniors in both East Madison and Monona. And so Mayor O'Connor is going to talk with you about some of the issues and some of the specific situations that some of our seniors have faced. Mayor O'Connor.
Good afternoon. I'm happy to be here representing the city of Monona. Many of you may not, it's a short problem. Many of you may not be aware that Monona has one of the largest percentages of senior citizens per capita of any community in Dane County. Our seniors are vital members of our community. Indeed, many of them helped to build Monona in the 50s and 60s. Monona's relationship with the East Madison-Monona Coalition of the Aging has played an important role in helping many of them maintain their independence and continue to be a part of the Monona community. Since becoming mayor, I've heard many examples of what the coalitions have done for seniors in Monona. For example, an 89-year-old gentleman living in low-income housing was about to be evicted because he could not keep his apartment clean. A case manager arranged for home chore paid service as well as food share and help paying his Medicare premium. He was also provided assistance with scheduling and going to doctor appointments. All of these services have allowed him to remain independent. In another case, an elderly widow who had no experience dealing with finances was being taken advantage of by her son and daughter-in-law, who were stealing money and setting up credit cards in her name, which they then used. A case manager worked with Adult Protective Services and the Monona Police to address those issues and arranged with the bank for auto payments for her bills. The manager then helped her sell her home and move into housing that she was better able to take care of, and where she would have more social opportunities. In Monona, we have a very active senior center. Our staff provides lots of programming and social opportunities and does its best to help with the problems of individual seniors, but we can't do it all. It's wonderful that we have organizations like the Madison Area Senior Coalitions available to help fill those gaps. Monona has been happy to support the East Madison-Monona Coalition's work in the past, and we look forward to working with the new, larger organization in the future. Thank you.
Hello, my name is Christine Beatty. I'm the director at the Madison Senior Center, and I had a very urgent phone call yesterday. Marcia Hendrickson is not able to be here, and she's certainly been the architect of the work that the four coalitions have been doing over the last 3 years. I'm very fortunate because Marcia gave me a script. So all I need to do is to read it to you. And please forgive me. Good afternoon, everyone. Thank you for being here for this wonderful celebration. Much as I wish I could be there, my role as a mother and a grandmother takes precedence as I support my son and his family who are mourning the loss of his mother-in-law after a 6-year battle with early onset Alzheimer's disease. We found out that Marcia also has a father in the hospital in Milwaukee, so she's very busy today. I'm so happy to be at this point in the journey and continue to be inspired by the words of the late Paul Kasuda, who tirelessly reminded me to get it done. Well, Paul, we can see the finish line now. What began with an informal conversation with my fellow executive directors over 6 years ago about sharing resources and reducing some of our individual administrative roles has grown into a 3-year planning process, resulting in our January 1st, 2019 merger. In August of 2015, thanks to the generous support of the City of Madison, we were given the opportunity to shape our destiny and design a new model of service delivery to meet the needs of a growing population of older adults in our community. We embarked on a planning process that involved hundreds of dedicated volunteers, including board members, staff, clients, community stakeholders, and elected officials. We enlisted the help of talented professionals like the Sort Soul team of Ben Williams and Dennis Johnson, and finally Derek Van Mel, to guide us through the process and make sure all voices were heard and represented. We had the legal expertise of Melissa Schultz, who has prior experience in many successful nonprofit mergers, and the marketing expertise of the Creative Company in developing our new identity. The result is the formation of a new agency, which will be a single, strong voice for older adults in Madison and Monona. By maximizing our resources and reducing duplication of services and ultimately administrative costs, we can ensure quality and consistency of services and programs. We will be able to more effectively address the issues of race and poverty and better serve the rapidly growing population of older adults in our communities. We are providing specific, targeted leadership opportunities to current executive management staff, which emphasize their individual skill sets and program strengths, enabling them to grow with the new organization. We have recruited a talented group of influential, dedicated community leaders to serve on the new board of directors, including several members of our existing boards, who will build on the solid foundation of 45 years of success and tradition as individual neighborhood coalitions, leading us into the future as a visionary, forward-thinking, innovative agency. Over a decade ago, as a new arrival in Madison, I had the opportunity to meet with a remarkable man, then serving a brief stint as a private citizen who was doing some community planning work on Madison's South Side. I was happy to share my naive observations as a new nonprofit executive director on how I viewed the city and South Side. That man, Paul Soglin, was happy to share his astute observations and his wealth of experiences with me. Mayor Paul Soglin has been our greatest ally and supporter in this process, and we would not be here today without his valuable help and the assistance of his staff. Paul?
So when I walked in the door, I'd said that I doubt I would be able to fill 2 minutes of the 7 that have been allocated to me, and I'm now trying to figure out how to get them down to about 20, having heard the previous presentations. First, I want to thank Christine, who read Marcia's comments. Christine has just been so valuable in giving us guidance and direction in making important choices and decisions regarding seniors in our community. And it was in the early 1980s that we opened the senior center downtown, and Christine has provided just spectacular leadership during this tenure. And I don't know if you're aware of it, but she's going to be retiring shortly, and whoever is going to follow her, we're not even going to talk about comparisons. It's not fair, and it'll be a tremendous help to our next leader, whoever it is, to give the same support that Christine earned and deserved over all these years. I want to also just mention Paul's. We have Paul Casuta was mentioned in Marcia's remarks, and I actually wanted to pay tribute to the work he has done. It seems it was about 600 years ago that I first appointed him to our Senior Advisory Commission, and he also was a constant voice and reminder of best practices and the fact that tomorrow is the deadline. Our county supervisor, Paul Rusk, I think started working on senior issues when he was about 16 years old and has not stopped. And his work and his advice in this area has been invaluable. as I go into some of the other comments I want to share with you, I want to recognize someone who's done a tremendous job, and that's representing not just seniors, but this area of the city. From the City Council, Rebecca Kemble's here, and she's just been a tremendous leader in so many areas, not just involving seniors in the council, and we look to her for just invaluable advice on a whole variety of economic issues involving fairness and cooperation and cooperatives and sharing. And that really gets to the essence of where I'd like to go. As I look back when we first formed the first senior coalition, and I didn't take notes at the time, I think it was the East Side or the Near East Side Coalition was the first one we funded back in the 70s. We had alignment and support from the federal government and the state government. It wasn't just the county and the city working on these issues. And I bring that up because right now it's very popular for people to laud municipalities. There's so many books that are now being written about where the action is at the local level, not at the state level, not at the federal level. Well, there's a reason for that. Not only do we have the best and most creative people, but it's because we're the only ones who are doing anything by default. The state and the federal government are abandoning us, and that is incorrect and wrong in that when we want to redistribute the vast quantity of state and federal tax dollars, it has to go to those governments and then be properly distributed and supportive. When we talk about young families, I'm always talking about 5 areas that we have to address to make sure that the household's complete. Well, those same 5 areas are actually important and critical regardless of the age. Housing is first. People must be housed. And I'm pleased to say that we've significantly lowered our vacancy rates in Madison in recent years. We're meeting that goal of 1,000 new affordable units in 5 years and moving on to even more strenuous ones. But we cannot complete the job, and we cannot do it right if we do not have the support of the federal government and a state housing program as they do across the river in Mississippi. So let's not forget that. And also, I want to point out that one of the great burdens we inherited was when the federal government changed the rules on who was eligible for senior housing. And so many of the units, which we had in Brittingham and Capitol Center and all the other units around the metro area, are now not just for seniors, but they're also for people with severe behavioral health issues and challenges. And we were then left to take on that responsibility, and that has stressed all the delivery of services to seniors. One of the areas we talk about is childcare. Well, most seniors are beyond that age where they have children that need care, but as was mentioned earlier, seniors themselves, particularly if they're going to remain independent, need supportive services, and those supportive services have to be paid for by one large government, whether it's the state or the federal government, and they are not participating to the degree that they should. A third area so obvious is healthcare. When we talk about healthcare, we talk about behavioral health and we talk about nutrition. There are programs like Meals on Wheels that are so valuable, but we can't run a program to provide access to healthy food and nutritious food based largely on volunteers. There has to be more done and more recognition of the role of those of us in government. There's a question of education. And I guess as we get older, perhaps education becomes a luxury. But I just picked up a book this weekend that I'm starting to read by a Chinese author I'd never heard of a couple of months ago. I am constantly reading, not always about government, but I enjoy my magazines, my books. I enjoy going to lectures, and I hope so many people here have taken advantage of the University of Wisconsin programs, which provide tuition-free access, but we have to keep our minds and our creativity moving along. That's one area where you never can get enough, no matter how old you are. And I'm saving the most critical to last: transportation. We once had the finest transportation system for seniors and people with mobility issues in the United States of America. Our door-to-door service was unparalleled. It was a national model. And over the years, the cuts in support from the federal and the state government has not only devastated our fixed route system, but it has devastated that mobility that was so important for older residents of our community, getting to the doctor's appointment, getting to the grocery store, getting to a facility like this. And here we are. And I just got back from Texas. You can't get much redder than Texas. They have regional transportation authorities. They have a 1-cent sales tax that goes solely for transportation in this area. And yet we've got leadership in our state government. We have abandonment of this playing field in the federal government. And we must renew our commitment, and we must set the bar back to where it was, being the best in regards to recognizing how critical mobility and access is to the people of our community and the people we serve. This is my long way of one very short message. I'm not saying who, but be sure to vote a week from Tuesday. Vote. Please go out and vote. That's what this is all about. I'm supposed to mention something about the benefits of the consolidation of the coalitions. It's about just the efficiencies or the elimination of duplication of services. It's about bringing all those minds together so that we can do better, and so that in every one of these critical areas, we will hit the mark of providing the best services, the best lives, and the very best that we are capable of. And that can only be done with a collaboration from the federal government and the state government, as well as your city and county government. Thank you.
Hello, my name is Katie Gallagher. I'm the current executive director at the West Madison Senior Coalition. And I have been working for the coalitions for 9 years, and I will be the marketing director with the new agency. And I've been leading the marketing committee in 2018 as we have chosen our new name. But before I reveal the new name and logo, I'd like to take you through our process on how we came up with the new name. So we first had brainstorming sessions with our staff, and we came up with key words that describe the work we do. Some examples are compassionate, navigation, pathways, problem solving, empowerment, partnerships, connections, and independence, just to name a few. I actually had 5 full sheets of words. Probably 3 columns too. So then we hired a consultant who came up with several name ideas based on those keywords. The process was difficult, and in the end, the transition board made up of executive directors and board members came up with the new name. And with that, I'm very proud and excited to reveal this new name and logo and tagline to you all. All right. So you can all read NewBridge, your connection to successful aging. The logo symbolizes the 4 Madison senior coalitions who have come together to make a new agency, connected to the past, but going towards the future, connecting or bridging seniors to resources, programs, and services. So we hope that NewBridge will help seniors for another 40 years and beyond. So that concludes our program, and we will open it up for questions.
Can you just speak to what are some specific efficiencies that you're going to see providing programs?
When we were looking at efficiencies, I calculated the number of reports and meetings that we went to, and I think in 1 year, between the 4 of us, we would assemble about 400 different reports, and we would attend probably 10 meetings a month. As one agency, we'll be able to cut many of those out, and we'll be, cutting it by a quarter. We also have a lot of staff who are planning programs, and 2 people may be contacting the same speaker to schedule an event. Now we can have 1 person doing things like that for the whole city of Madison.
So any other program-related efficiencies where you might have been going to one for this, and now you're going to
Well, we're looking at how we can integrate some of the supervision and staffing of some of our programs, and so we're working on that. We haven't explained all of that to our staff members, so we're still in process of that.
What will happen to the 4 different locations with the merger?
Okay. At this point, we're planning on keeping all 4 of our locations open. We really believe it's important to stay firmly connected to the different communities throughout Madison and the Monona area, and so we want to have locations throughout the city of Madison. All right. I believe we have cake.